Greetings everyone, this is Edward Graham from EKU, NSC 892, Evidence-Based Projects in Advanced Nursing Practice, and we're going to see if we can wrap up a project proposal in 7 minutes addressing pediatric suicide. So as a continued problem that affects the United States youth population, suicide rates have continued to increase yearly rather than decrease when looking at trends overall. This project, known as the Pediatric Excellence in Decreasing Symptoms for Treatment of Depressed Youth, seeks to use a 26-week program that utilizes both the treatment team and the guardian and client to act as change agents while attempting to decrease these symptoms. A couple things to realize are that the background and significance of this project comes from the fact that 1 in 5 of the United States youth will have at least one depressive episode throughout their adolescence, which continues into adulthood. Suicide rates in Nevada average 13.5 per 100,000 youths, and this is with attempts. And it's also the second leading cause of death for children aged 12 through 17 in Nevada, and also becomes the third leading cause of death for those children 10 to 14 years. So second for 12 to 17 and third for 10 to 14 makes for a significant setback for the Nevada youth. Treatment will always come with some form of setback, which is to be expected. And this comes from Malai's transition theory, which states that there are going to be situational or operational and mental health situations that require one to recognize that there will be different forms and setbacks throughout their youth that will allow them to move forward. With that being stated, it's to be recognized that there must be some subjective and objective data that is going to be used. So what we will do in this program would be to have a meeting among the healthcare team and the child and guardian initially to draw out a plan that is expected to be followed throughout the 26 weeks. And this will encourage the participation of the whole entire team, which would be focused solely on the treatment of the individual rather than using an algorithm. So what we would do is we would use the patient healthcare questionnaire, which is a 9-question subjective form that allows the healthcare team to gauge the initial reaction for that individual over time. So week 1 would probably be the worst, and every week they would revisit that with the healthcare team, and bi-weekly there would be scoring of the healthcare questionnaire, which is also known as the PHQ-9, among the therapy team alone. So every week the child would have therapy, followed by a treatment team meeting. Every other week there would also be, in the treatment week, the healthcare team by themselves addressing that questionnaire. The other significant portion of this program would be that this program is cheap to implement, requires maybe $700, which would require the use of a single computer. We would need office space, and of course we would have to get paper for printing posters and another ream or two of paper that would be used for the PHQ-9 printout over time, which would almost be like a report card, so that child and that guardian could go home with something to work towards. Now, the simple part about this is the scoring can be done with everybody present, which is a beautiful thing. We have to make sure that the therapists and prescribers are also on the same page. So the use of the psychological intervention in this particular case is going to be CBT, which takes about 60 to 90 minutes to administer, and then it would be based on the transition theory, because that's going to be what's going to help this child go throughout their childhood into their adulthood lives. Hopefully, the behavioral and emotional changes will be noted quickly, and that there wouldn't be much to actually worry about over time, because this is going to be an outpatient program. The only thing that would actually preclude these individuals would be active suicidal ideation, which would require that lady or gentleman to go into a more acute form of treatment. Now, the one beautiful thing about going throughout this is that the client is going to be facing future goals to work on. So these goals would have to be subjectively stated, and we could objectively view the client throughout treatment, and that could also be implemented into the PEDS TD program. Coping skills would have to be taught. The recognition of these transitions for future living would also have to be noted immediately, because without that, how can you encourage or empower someone else to succeed? The big change is going to be probably right around the first and second week, because there would be 2 treatment sessions in the first week and in the second week to make for a total of 4 prior to actually scoring any of these PHQ-9. So the first one would show hopefully the highest rate of depression, and then subsequently each should be lower and lower towards the tail end of the program. All of our stakeholders would have to be notified at least once per month, being that this is a 6-month program. That would probably take a total of close to 7 to 8 months, depending on the speed of approval. The beautiful thing about the program is the fact that it will not take anything away from the scheduling of staff, because the staff who are currently, say, in an inpatient would be able to be decreased, and the outpatient staffing would be able to increase. This, in the end, would actually decrease the utilization of funds from the lack of necessary emergency medications, from active suicidal patients. The overall funding wouldn't have to change. It would just be allocation from one side to another side of a building. With that being said, there would also be less of an issue regarding patients requiring additional medications on their way to transition towards home. The overall hope is that these skills can be used in replacement for additional medications to help these ladies and gentlemen go further on in their lives. Any life is worth living, and every single child's life that is lost only shows a lack of effective treatment and a failure on the behalf of the treatment team. I appreciate your time. I hope this makes the poster much more easy to digest. Once again, my name is Edward Graham, EKU PMHNP, concentration class NSC 892. Thank you.